My name is Paul Kershaw, and I have the privilege of being the founder of Generation Squeeze. And I'm joined today by many of our fabulous Gen Squeeze leaders behind the scene. You just heard the wonderful Jennifer Fox. There's also Andrea Long and Megan Wild, and we, along with others, have been launching into budget season, which, as I will share in a moment, is a big part of the work that we do in our organization. I'm coming to you today from the unceded ancestral territories of the Katzie people. Um, the Katzie territory is at the confluence of two beautiful rivers in British Columbia called the Pitt River and the Fraser River. And I guess what I would call colonized maps call this region Pitt Meadows, and it's part of Metro Vancouver. I think it's really critical for somebody like me who self-defines as a homeowner to emphasize the unceded part of the territory, because anybody living in Metro Vancouver these days, or many cities from coast to coast to coast, if you happen to be a homeowner like I am, you could be accruing a great deal of wealth in your home on land. And in my case, it has been unceded, and that means that my social location, my relationship to the history of colonization is fraught. And as we think about truth and reconciliation, I have a lot that I have to be contributing to that process and really thinking deeply about movements for land back. For those of you who might be new to Generation Squeeze community calls, it's a quick reminder that we are a charitable think and change tank, not just a think tank, but a think and change tank. We aim to promote well-being for all generations. Our vision is a Canada that works for all generations, and we do so by championing this cause of generational fairness to preserve what so many of us hold to be sacred, like a healthy childhood, a healthy home, and a healthy planet. We're an organization I think is leading the way to help leave a legacy where every grandparent is leaving a better life for their kids and grandchildren, and not just a legacy of unaffordable housing or extreme weather or unpaid government bills. And we're also a place and an organization that's striving to make Canada work for all generations so that hard work actually pays off for younger adults today, much like it did in the past. Not where we're seeing so many younger adults reaching out to us worrying that they're doing something wrong because their rent checks their rent, I should say, not their checks, their rent keeps outpacing their paycheck. To do this work, to make Canada work for all generations, so much of our time and energy is devoted to influencing government budgets. BC just launched its most recent budget last week. We were in the lockup evaluating it. And one of the things we find a bit vexing about what many call budget season is the media often treats it as just a few day event. The announcement happens, you learn a little bit what's in the budget, and that's all there is, folks. But at Gen Squeeze, we know that budgets really are the most important documents that governments create in a year, that's shaping every other piece of policy and legislation. And if you don't see an idea in the budget, it likely isn't a priority. And so for many years now, we have been trying from coast to coast to coast to leverage a lens of intergenerational fairness and intergenerational solidarity into the provincial and federal budgets of the day so that we integrate that perspective to make Canada work for all generations into the machinery of government. And we were keen to hold today's community call in the wake of the most recent BC budget because we anticipated that we were going to achieve an incremental systemic change victory. And I want to draw people's attention to it because while it hasn't a game changer yet, I think an historic shift is starting to happen in the BC budget. And we're hoping to see this historic shift not only take firmer root in BC, but then see it spread from province to province to province and also to the federal level. And here I'm showing before you a slide that is a cutout from the strategic plan that the province announced in BC last week. And they have a strategic plan in every part of the budget. This part of the budget, they're short. It's only 6 pages of text. But what impresses the heck out of me is that the first couple of pages of those 6 pages really are devoted to, in many respects, cutting and pasting text from Generation Squeeze. And so much so that the strategic plan actually includes a call out to the work that we are doing in our organization to draw attention to the fact that our country faces demographic challenges as our population ages that we need to address. These are our parents and grandparents who we love. But at the same time, governments need to ramp up investments in young people so that they can succeed, so that we recognize that a younger demographic is coping with this growing gap between home prices and earnings, like going to school longer, they're landing jobs that after inflation, tend to pay less, they're increasingly locked out of home ownership, and this consolation prize of rising rents is just terribly lousy. And people adapt by often then delaying starting their families, but when they do, childcare can be another rent size payment, parental leave can be another mortgage size payment. That's the private vice grip in which younger folks find themselves, and that private vice grip is tightened still further by public forces that are leaving larger government debts than in the past and a frightening amount of environmental debt. So the fact that we have a strategic plan that says it wants to keep working for all generations and acknowledging, embracing work that we're doing here at Generation Squeeze, we see that as an incremental step for then guiding what this provincial government's going to do henceforth. And in some regards, we see that this material, this information in the strategic plan is beginning to herald a new era of generational politics in British Columbia. Because for the first time, a budget revealed what has been until now a hard truth to say out loud, namely that governments starting decades ago were kind of asleep at the wheel when it comes to preparing for the needs of our aging baby boomer parents and grandparents and aunts and uncles. And the failure to prepare on that front is directly related to why BC, for instance, is running a very large deficit outside of recession, a larger deficit than they ran during the pandemic. And why, as I'll show, the federal government runs a large deficit, and why Ontario runs a large deficit. And notice I just did 3 different governments, a Conservative one, a Liberal one, and an NDP one. So this isn't really a partisan issue. This is actually a structural issue. But efforts in the past to draw attention to this structural issue were deemed in the world of politics often too politically risky to shine a light on. And I'm delighted that Premier Eby is being brave enough to shine a light on this issue, because the first step towards solving a challenge or a problem is acknowledging that you have one. And so here's what the challenge is, and I'll draw your attention to the text that for the strategic plan that I'm wanting you to see, where any government today of any political stripe is going to say that providing high quality medical care remains one of the most important things we want to do, but it's also one of the fastest growing costs, primarily due to our aging population. And as the strategic plan says, in the 1970s, there were 7 working age adults for every retiree. Now there are only 3. That made it easier in decades past for the province to cover the medical care costs of our aging loved ones. Let me just kind of bring that text to life in this visual and just remind us that we've known for some time in Canada that we had this beautiful baby boom. We call it a boom because they were a big group, and we knew that initially they're young, and like any life course, they're eventually going to grow older. And some decades ago, we adapted our Canada Pension Plan in recognition that in order to keep it strong and solvent and there to support today's retirees and those who will come in decades ahead, we needed to adapt how we are collecting revenue for it. And we're asking in many respects that baby boom population, hey, let's have you sort of prepay for what you're going to want to use later in retirement. Unfortunately, governments didn't do that for old age security, as I'll show at the federal level, or medical care at the provincial level. And now, regardless of what government is in office, provincially or federally, they are going to be holding a heavy bag fiscally to compensate for the fact or cope with the fact that we didn't adapt in the past. So for instance, in BC, if you look at what they're projecting in even a couple of years from now, we'll still have a very large deficit. That deficit is in many respects commensurate with the increase in spending on medical care, and much of that medical care, at least half of that, is being driven by the needs to care for our aging loved ones. Prior to the current government in BC, a premier like Christy Clark would have been managing similar fiscal pressures primarily by saying any new spending that was going to happen would be largely for medical care. And then there were not a lot of investments left over to, say, scale up something like childcare, invest in post-secondary and whatnot. So when I would go into those budget lockups and I would crunch the numbers about how much spending is growing for later in our life course compared to earlier in the life course, since Canadians use more medical care after age 65 than we do in our first 6.5 decades, it was pretty easy to show, look, most of the new spending is going towards our parents and grandparents, less for their kids and grandchildren. Indeed, the rate of new spending under Christy Clark's 6 years in government was growing spending for an older demographic 4 times faster than for a younger demographic. What's so fascinating about the 2024 budget and the leadership from Premier Eves, as I'm now showing you different parts of the text, like his government is, quote, determined to make BC work for all generations and committed to planning for all ages and investing wisely in well-being from the early years onward. And that is having really significant impacts for investments for a younger demographic. Whereas Christy Clark was growing spending for an older demographic about 4 times faster. Now, now Premier Eby is still growing spending faster for an older demographic, but only about 50% faster. Why does that matter? That matters because the provincial budgets under Premier Eby are delivering more money for childcare, more money for housing, more money for post-secondary, more money for K-12 education. Here is a visualization of what the new spending in the 2024 budget looks like. There's lots to say, and I'll try and unpack quite a lot of it, but I'll draw your attention right now to the right-hand side. And if you look at that pink baby bear of social services, like that's bigger than it would have been in the past. The post-secondary is bigger than it was in the past. Even grade school spending is like bigger than it was in the past. I'm a little bit nervous about the housing being so small. It's a negative number. But if I were actually showing you spending since 2021, the year before Premier Eby came into power as premier, you would actually see that that little gray raccoon isn't negative. It's actually more like a fox-sized animal. And so right now we're honing in on the new spending from this particular budget, but there's a broader legacy that I will want to give Premier Eby some credit for. So all this is to say, when thinking about the BC budget, as governments are not, when you have a government that says we're not only going to protect our medical care system for the aging population, we're also going to start investing in a younger demographic in recognition that their hard work isn't paying off like it used to, we're running into a revenue resiliency problem. We're running into a kind of structural deficit that was already large because we didn't prepare for the aging population. And now we need some resources to invest to adapt to challenges facing younger folks. Large deficits are the result. And that's no small thing. Because if you think about sort of the accumulation of deficits over time, and then you have a debt that we're having to service with interest payments, by 2026, interest payments in a single year are going to be $5.7 billion in British Columbia, which is cumulatively much, much larger than the combination of new spending on housing and childcare. Not new spending, just cumulative spending, I should say, on housing and childcare in that year. So there's a legacy, there's a tension with unpaid government bills. They do not come without costs, and there's a risk that unpaid bills from today and in the past are crowding out investments in a younger demographic and things that matter so much to them. So I think one of my punchlines about the BC budget is that we are delighted to have worked with the Premier's office and Deputy Finance Minister regularly over the last year to try and bring a generational lens to their spending and find better balance in investing between young and old alike. But now we're going to need a premier to be brave enough to engage with British Columbians in a hard conversation about how we, and especially in a more affluent, older demographic, how they are wanting to pay for the services that we as a society want. One last observation about the BC budget, and then I'm going to use this to sort of inform our thinking about other budgets across the country and federally. At Gen Squeeze, we are really keen to be promoting population health. And one of the key tenets of health science is that health doesn't begin with medical care. And so again, we are really delighted to see that language come out in the provincial strategic plan, where they say that not only is there a commitment to high quality public medical care and that remains steadfast, but that we know that health goes well beyond the clinic or hospital. It starts when we invest in affordable homes, livable incomes, affordable childcare, healthy communities, and a clean environment. You could literally be cutting and pasting that language from a Gen Squeeze website. We've been working with Premier because in his first 2 budgets, we could actually show that he was really aligning well with that health science. In the most recent budget, the spending going forward is actually still tilting a little more to the medical care side than investing in the building blocks for a healthy society. Whereas health science would say, hey, governments, if you want to promote population health, you want to improve life expectancy, reduce avoidable deaths, what you're wanting to do is actually have those investments in the post-secondary, the social services, the childcare, the housing be a little bit more weighty than even medical care spending. And some of you might say, but wait, Paul, we have such a challenge accessing doctors today in BC and across the country. How can you be How can you be worried when spending on medical care goes up more and more and more than anything else? And I think that, I'll draw your attention to a report we just put out last week to remind Canadians that we have more physicians per capita than ever. Back in the day in Canada, when baby boomers were young, there were about 144 physicians for every 100,000 Canadians. Today, there are 247. And it's been in a steady rise since Prime Minister Trudeau has been in office. And we have a much higher proportion of family doctors than we did in the past as well. And if you look at the BC data, BC has the largest number of doctors per capita, including physicians per capita, of any other province in the country. And so there's reason for us to say if we're worried about the long line of people queuing up trying to get access to medical care, you can't just focus on the supply of doctors and nurses. What we need to be focusing and asking on is why is there such a long line of patients in the first place? It's like a Taylor Swift concert. It's hard to get a Taylor Swift ticket, not because she doesn't play the biggest venues in the world, but because there are more people lining up to get access to her concerts than most others. So it is to some degree right now. We have too long a line of people queuing up for our medical care. And that likely reflects in part that we are not investing in the building blocks for a healthy society as urgently as we did in the past. So I want to just wind up quickly and say you'll see similar issues in other budgets coming ahead. Right now, I'm going to be reflecting on what we saw in 2023. We're anticipating some of these challenges going forward, and we're constantly trying to improve them. The next infographic is going to be based on this table from the most recent fall economic statement federally. And you can see kind of similar patterns in the federal spending. The biggest investments are coming later in the life course. Old age security is outpacing everything. Medical care spending is not something that the feds have disproportionate responsibility for, but nevertheless, they have a large share of funding, half of all which is going to those over 65. If you look at how big old age security spending growth is by comparison with, say, childcare, and we've given the federal government credit for doing something historic with childcare. We haven't seen investments in childcare in the 10-a-day system in the last half century, and so it's great. But we need to recognize that that scale of investment in childcare, as impressive as it is but a small percentage of what we're actually doing later in the life course. So we have a challenge at the federal level because when I was listening to the opposition leaders respond to the federal fall economic statement most recently, you'd have, say, the NDP leader say, and I quote, "This isn't even a mini budget, it's a micro budget." But I don't understand why Jagmeet Singh says that, because the fall economic statement shows that the federal government is adding $115 billion to old age security over the next years. No government has ever increased support for retirement income security by this much. Well, at least they haven't done so in decades, and I think it's ever. I just probably haven't gone back far enough to be able to say that with certainty. And then you have the Bloc Québécois leader, for instance, say there's nothing in the fall economic statement for seniors. But the fall economic statement adds $150 billion in new spending on retirement income supports and medical care for those over 65. And that's 70% more than all new investment in employment insurance, the Canada Child Benefit, childcare, housing, and the clean economy combined. Or for instance, you have Mr. Poilievre say, oh, these large deficits that are being run federally are caused by the prime minister. But again, that's not entirely accurate because more than 80% of the $186 billion deficit that we're projecting in the most recent fall economic statement, and that's over the next several years, over 80% of those deficits, when we're not in a recession, can be accounted for by the fact that spending on old age security and spending on medical care for those over 65 is growing so rapidly by comparison with other things. And the prime minister is not entirely or really even largely responsible for that, because that reflects the previous failures from decades ago to plan adequately for our aging loved ones who are baby boomers. We partly adapted with the Canada Pension Plan. We didn't adapt for OAS or medical care, and now governments of all policy stripes are holding the bag. In the Alberta budget, which will come out tomorrow, you can see similar patterns. Medical care is definitely the most popular investment. And when you do that, given the age patterns and how we consume medical care, I apologize, these tables aren't nicely visualized with animals, but I can give you the punchline nonetheless. Alberta has the biggest age gap in spending of any province in the country, I believe. They certainly amongst the populous provinces of BC, Quebec, Ontario, and Alberta. And so a markedly larger age gap in Alberta by comparison with, say, BC and Ontario. And that reflects that, Alberta is about as generous as spending on younger folks, but they're, as say BC, but they're much more generous than the other provinces when it comes to investing in an older demographic. That absolutely reflects that typically when they're growing spending, the majority of the new spending is going to medical care. And some in Alberta might think that is a point of pride. Of course, we should be doing that. But if you look at data from the Canadian Institute for Health Information, Alberta ranks below BC, Ontario, and the national average on health outcomes like infant mortality, heart disease mortality, cervical cancer mortality, rectal cancer mortality, avoidable admissions for lung disease, avoidable admissions for diabetes, and even lower life expectancy. And so when you're spending more on medical care to get poorer health outcomes, that is absolutely consistent with the health science saying medical care accounts for less than a quarter of what makes us healthy and well. The building blocks for a healthy society, affordable childcare, safe and affordable homes, little poverty, a stable climate, these are the things that keep us healthy and well. And we need to be disproportionately investing there if we want to get the better outcomes. The Ontario budget will see very similar patterns as well. As I'm running short on time and I want to hand it over to questions, I'll just draw your attention to the post-secondary little mouse. By comparison with the mole, the interest payments on debt. Interest payments on debt are more expensive now in Ontario than is spending on post-secondary. And I think that is a vexing and frustrating comparison to have to make. So this all brings us back to we need to build a commitment to intergenerational fairness more into the machinery of government. That's why we are delighted to be seeing progress in British Columbia. We're wanting to see that progress happen from coast to coast in other provincial budgets. We're working hard to encourage the federal government to launch a task force on generational fairness to address why hard work doesn't pay off for young folks as it did in the past and how we can invest to rejuvenate the payoff for their hard work while also protecting the healthy retirements of our aging loved ones. It comes to the question that we sort of featured with our call to our community call today, our invitation. Are we paying for the Canada that we want? Death and taxes, so the joke goes, are the only two things that are in life that are inevitable. One of our problems at Gen Squeeze increasingly is that when you talk publicly about taxes, you get people sending you nasty emails and wishing that you would die. And that level of vitriol is getting in the way of our having, the kind of conversation we need about not just the more spending that we need, and Gen Squeeze is an advocate for that, but how are we going to pay for the new spending that we need, and how do we do that in a fair way between generations? Unfortunately, other organizations are kind of regularly attacking us as we're trying to do that. So it's so nice to have a community call today where we're kind of with friends, with allies, and can kind of have that motivation renewed with everyone on the call. Because there's no doubt that we have a revenue resiliency problem in our governments. I just showed you that with a quick water ski or a trip to the zoo across all of the many budgets in the country. And it makes me think back to the days of sex, drugs, and rock and roll in the 60s, because that was the last time that Canada had a really comprehensive analysis of our tax policy, our revenue systems. And I'm thinking as baby boomers are aging and there's pressures on the medical care and retirement security that they want, and there's pressures on their kids and grandchildren, and there's large unpaid bills that we're leaving for their kids and future generations to pay. I'm wanting the boomers in our network, the older, especially affluent older folks in our network, to help us make talking taxes sexy again. Because we're going to need to do that if we want to preserve our status as one of the greatest countries on earth in which to grow old, and to overcome our status as an international laggard when it comes to investing in children and youth and their parents, as UNICEF routinely tells us. So, friends, there's things we can do. We're hoping that people on this call will join in as budget heroes, because it isn't just a short time, around the announcement of a budget. It is about shaping budgets all year long. And we're hoping that we can celebrate and amplify BC's commitment to generational fairness and push our federal government to, launch an even more aggressive task force to take these issues on. So do visit us at gensqueeze.ca/budget actions and share with the federal government, share with your MP that something historic is happening in BC. It's signaling that not only historic for policy, but it's like politically important because BC is about to head into an election, and the incumbent government said it's worthwhile featuring this generational lens to be successful in the next election. And so I think we're hoping that the federal government will actually see that as a political insight too. If you are a member of our community in BC, reach out to our Premier's office, send a note saying, congratulations, we really do embrace the commitment to generational fairness that you've included in the strategic plan. We want to celebrate that because when leaders know other people think it's important, it compels them to want to do more of it and gives us more power to hold them accountable. If you're outside BC, if you're in Alberta, in Ontario, Atlantic Canada, Manitoba, draw your MPPs or MLA's attention to this important integration of generational fairness into the BC strategic plan and call for that as well. We have provincial budget recommendations for many jurisdictions that you can share directly with your MLAs as well. And more generally, help us attract others to recognize and care about budgets as much as we do. We have a number of tools and a number of assets to convince people that budgets really do matter, why we should care about them, and some good podcast episodes and op-eds in the Globe and Mail that will be revealing why it matters to influence budgets so that we improve public policy in this country to make Canada work for all generations. I'll apologize to my team. I'm a few minutes over time. But I hope that I was managing to keep people's attention and interest and can't wait now to engage with the many, many questions I see coming in the chat.
All right, Paul, maybe I will just read out some questions for you. The first one was from Uric, and they are asking, in all of your conversations that you've had with politicians, obviously housing is a big ticket issue. But do you have any perspective on why housing was not prioritized in the most recent BC budget?
Yeah, to be honest with you, I will be surprised that when I next meet with people in the Premier's office, that they're actually aware that that was going to be the spending trend. I think sometimes some of these key patterns risk getting lost. And that's why we're like, hey, you need to be paying attention to the age pattern in spending and also where spending is going specifically between the building blocks for healthy society and into medical care. Because I know that this is a premier who actually previously was our housing minister, and he has brought a more comprehensive commitment to housing policy than any premier I've seen before. And yet still on his watch, something's kind of gone funny in this most recent budget. Just to be fair, though, if you were to compare it to 2 years ago, he has added about $1 billion to operating spending on housing, and it's kind of staying at that level. It sort of peaked and now it's dipping a bit, but it is bigger than it was prior to 2021.
Great. The next question is from Tim. He's asking, it sounds like some of this success has been achieved. So calling out that we need to increase spending on younger generations and the social determinants of health. But I'd love to know a bit about the strategy and actions that yielded these positive results so they can perhaps be replicated here in Ontario.
Yes, that's a great question. I mean, there are many parts to this strategy. Some of them include working directly in the halls of government. I think last year we had 71 briefings with senior officials federally in the BC government and in Ontario, but we would have had about 40% of those federally, 40% in BC, and only about 20% in Ontario. So we're not as strong in the Ontario government. I do recall some highlights with meeting with the housing minister's team, meeting with the deputy premier, who also happens to be the minister for health. So, it's part of the relationship building. And for better or for worse, we don't have as strong relationships with the current Ontario government as we did previously. It's also about an outside game. It's about changing hearts and minds so that we build political cover. And whether it's the op-eds that we're routinely getting into the Globe and Mail or the media that comes to us, and when we counted up our media for the 2023, I think we had 1.6 billion media impressions. We're having 6 or 7 unique media hits every day per year, and I think that is trying to blow against the wind to some degree, blow against the wind that People are like, we're really struggling to access doctors. That's true, but people aren't yet realizing we have more doctors per capita than ever. Or we need to care for our aging loved ones. But look at the data. We're doing that quite reasonably well, at least by comparison with what we're doing for their kids and grandchildren. I think, and I'll just wind down so I could answer, take the whole time to answer this question. This is our lifeblood. This is like the blood, sweat, and tears of what we do as an organization to try and gain the access and make it compelling and make it nonpartisan, but make it also politically winnable for whatever government we're talking to. I think we're at a moment where when we talk about sexism or racism or classism or colonialism, people realize that those are systemic problems. And when you make comparisons between men and women, between different race or ethnocultural groups, etc., people aren't thinking you're pitting those groups against one another. They're saying, power structures already do that. We still do run into a difficulty of like when we make comparisons between what's happening for young and old alike, people are like, you're pitting the generations against one another. And that then becomes our Achilles heel or our kryptonite, our weakness. And we're still needing, and this is why I love that we're getting a larger group of older allies in the Gen Squeeze movement. We need to like, no, those comparisons aren't pitting generations against one another, drawing attention to the tensions, the potential gaps between what we're doing for young and old is the way forward to address them so that we protect what we need for our aging loved ones and invest importantly in their kids and grandchildren without leaving large unpaid bills for those who follow.
Excellent. The next one is from Chantel, who's here from the BC Poverty Reduction Coalition.
Chantel, welcome.
Yeah, she's asking about the investments in the areas of social determinants of health and how they actually impact affordability and perhaps impose poverty. So are we designing budgets? Basically what she's saying is, how do budgets affect poverty?
Yeah. So right now, how do budgets affect poverty? Can I change? Oh, I can't change it on the fly. Hey, was it Chantel? You said Chantel, you see this blue box? Read the line immediately below it. I'll read it out loud. By supporting people of all ages, we can design provincial budgets that tackle both the rising cost of living and reduce pressure on the healthcare system. I love this line in the strategic plan. This is something what any poverty reduction group, alongside Gen Squeeze and others, like we need to hold on to and to remind them that we have an affordability crisis in our province and across the country right now, especially for a younger demographic, newcomers of any age, about 20% of older folks who are renters. And those affordability challenges are a big part of the reason why we're having lots of people lining up to get into the clinics and our emergency rooms, where actually it is not the most effective place to often address their issues, if only prevented problems from growing out of hand. Can we mute Jake for a second? Thank you. Chantal, I kind of lost my train of thought there, but the long and the short of it is when maybe I'm going to say something a bit provocative. I'm not sure this is the perfect example, but this was something that struck me in the 2024 BC budget. The BC budget added more money for in vitro fertilization to help people deal with their fertility issues. And the line was, people should be able to have the kids that they want. And there was a part of me like, that's beautiful. But that's what, once again, kind of going to a medical care system to address issues when if you talk to people about why they're not actually having the number of kids that they want, they'll say, I can't afford another bedroom. I can't afford to pay my rent. And it is the cost of living issues that have been the hardest in BC for young people for some time, which is why BC has the highest average age of birthing, the highest proportion of cesarean sections. And so we're using our medical care system to kind of like compensate for some of the socioeconomic challenges. And I think that we need to remember and help this government remember that their mandate letter for the minister responsible for poverty reduction and social development says poverty makes people sick. And in the first two budgets from Premier Eby, he was like, yeah, I'm finding more money to kind of address poverty. Community college is getting hacked. And I know my colleague Megan in particular is working hard behind the scenes to unhack that hack. And so there you go, Chantal, I kind of am up and down with my train of thought, but I hope that that's a part of an answer. I'm happy to carry it on afterwards.
Yeah, her follow-up, Paul, was about an example that there is no investment in funding in post-secondary, which it seems like that would be offloaded onto students, especially international students. So what's your take on the minimal investment in post-secondary and how that will affect affordability for people like that?
Yeah, if you go to, let's see, where's this study? quickly draw your attention back. This one. If you go to this study, Health is More Than Medical Care, you'll see data that tracks how across Canadian provinces, and especially in British Columbia, we have retreated from really growing spending on social and education services, including post-secondary, by comparison with medical care. Like in the mid 70s, we would have had BC was spending about 30% more, if I'm remembering correctly, on social and education issues than on medicine. Now they're spending about 35% less. And so what that means is we've really loaded more of the pressure onto individuals to be covering their post-secondary costs, and why grad students in my program are in one of the most expensive cities on the planet, and it's their cost of living that's even more challenging now than their actual tuition. And more students are having to rely on food banks and shelters to get through. So I completely agree, and this is in line with why we're saying, hey, we want to make sure we protect a publicly funded medical care system. But if we really want to improve access to that, we got to invest in the building blocks for a healthy society. Education is so critical to that, including post-secondary.
Excellent. All right. The next one is from Dave, who's the city councillor from Victoria. And most of your talk is focused on that higher level provincial budgets. But Dave is kind of wanting to drill in a little bit more on municipal governments and their depleted budget reserves due to deferred contributions. So really about municipalities also have kind of hamstrung themselves by suppressing new housing for so long that it's suppressing their tax base.
Yeah, what an interesting conversation. So Dave, here, I just want to come back to my slide. Dave, the reason that we focus on federal and provincial governments and their budgets in particular is, one, we're a small team, and so we need to be laser focused on where we think we can have the biggest impact. And federal and provincial governments collect about, I think it's 93 cents on the tax dollar. I think municipalities are about 6 to 7 cents of the tax dollar. And so your revenue, as you're saying, is constrained, and your policy levers are important, especially zoning when it comes to housing. But often you're experiencing the challenges of federal and provincial budgets that I would say are missing the mark when it comes to investing where well-being begins. So if you think specifically, I think you're asking about the contributions, the developer contributions on new housing. I'm one of the commentators about housing would say, I think we have been making a policy and tactical error when we're trying to collect so much of the contributions for adapting to our housing challenges from those building new housing. I think there are reasons for us to be sympathetic when developers saying, hey, when you add on new charges to us, I have no other option but to really pass some of those new charges on to whoever's going to rent or buy what I'm building. And I think that we can have some sympathy for that observation and some sympathy for the people trying to move into those new buildings as renters or owners. And I raise that because I think what we haven't been doing enough is talking to people like me. And there are many people like me in the greater Victoria area, Dave, where you've been a homeowner for some time. In my case, 2 decades. My home is now, it's a single detached home. It's about $1.5 million more valuable now than it was some years ago. And almost all of that wealth windfall to me is sheltered from taxation. Just think if we were to ask people like me to contribute slightly more from the wealth windfalls I've been getting while I've been sleeping and eating and watching TV, much more of a wealth windfall than I have from contributing to my pension alongside my employer at a good university that pays me well. And we're a strong voice at gensqueeze to have a tax shift and sort of shift some ways of raising revenue from things that seem a bit inefficient. Sometimes I think that is developers. Sometimes I definitely think it's income for middle, lower earners, renters generally, and asked to raise additional revenue to compensate by going to those of us who have benefited from rising home values. So I bet you that provokes a bunch of observations and thoughts from you that I would love to pick up in the days ahead.
Great. And I think Chantel is asking a few very lengthy follow-up questions. So maybe we'll just hand the mic over to you, Chantel, if you can unmute yourself, just to get some clarification on exactly drilling into what you wanted
Yeah,
Paul.
that's okay. It's not entirely necessary. Sorry, I'm just a bit sick. The question that I kind of had wasn't so much about like how a budget interacts with poverty. I'm very well aware of how that works. My question was oftentimes in these government budgets, we see kind of like one-off investments into some areas that don't really solve like the systemic nature of the problem or fund the infrastructure in a way that doesn't actually impact the way that um, impact people who are trying to access that infrastructure. Post-secondary is a really good example of that, where we've seen, investments going into unaffordable student housing through loans, government loans to institutions, through different kinds of like one-off programs that don't actually impact the bottom line that students are paying, which is tuition. And I know that a lot of student groups have been calling for, to do an investigation into the public funding model of institutions, to have more broad-based funding, operational funding for institutions, so that there isn't such a reliance on students to be paying for the institutions to exist simply.
Yeah.
And though we do see like some expansion for seats, we don't actually see that broad-based operational funding that has really been the call for over a decade.
Yes, I'm sorry if I didn't interpret your question adequately the first time. Some of the first thoughts that come to mind in light of what your just recent observation would be the following trend. Consider these two demographic changes. Today, by comparison with the mid 1970s, there are about 4.5 million more people over age 65. And today, there are about 4.5 million more people getting post-secondary degrees. For those over 65, we've increased annual spending over $40 billion a year. For post-secondary, I think if my numbers are correct, if I'm recalling correctly, it's like 2 to 3 billion a year. So one 4.5 million demographic change is doing like tens of billions. One's sort of driving a rounding error on those tens of billions. And I think that that is absolutely part and parcel of why we've got this structural problem that is really disadvantaging people who are having to go to people who are going to post-secondary more. So many more people are needing post-secondary to compete in today's economy, and increasing now with multiple degrees. And so student debt is something that then looms large. And then what's so vexing is student debt almost at certain moments can seem like the lesser of the problems to manage by comparison with the cost of housing. All the reasons why Gen Squeeze is saying, look at the age pattern in spending, look at, are we investing in the building blocks for a healthy society by comparison with medical care? I'll draw your attention here, just looking at some fine print from the budget. The capital budget for BC on medical care in 2024 is 4.4 billion. The capital investment on new housing infrastructure is 0.7 billion. It's like medical care is getting 6 times more capital investment than housing, and that surprised me when thinking about how critical housing is today right now, both from an affordability and a determinants of health standpoint.
Paul, maybe I'll ask you a question that I've gotten a lot on, as some people may or may not know. I'm working on the Gen Squeeze Twitter page, answering people's questions and engaging with our followers. And one of the questions that we've gotten since the budget came out is asking, do you think this is really a real fair commitment by the government to highlight this generational fairness piece and a commitment that will be lasting? Or is this just posturing ahead of an election? And how can we hold governments to account on this promise that they've made?
Right. Well, that goes back to the overarching theme of like, how do we build this fairness, this commitment to intergenerational fairness into the machinery of government? So a strategic plan is not an inconsequential step, but if it just remained as a strategic plan and then didn't shape how the machinery of government unfolds, it will not achieve its potential that we intended and worked so hard on. I will confess that we had also been working to have not just the language of the budget change and be featured in the strategic. We had expected some fiscal documents to start integrating some of the age analyses and the analyses of like, how much are we investing in the building blocks of for a healthy society by comparison with medicine. We've been asking them to integrate these metrics and monitor what we call these key performance indicators so that our cabinet ministers would be able to follow the fiscal trends more easily. That didn't happen for this budget, and we are going to work tirelessly to see that happen in the next budget. My sympathetic view will be that the machinery of government changes slowly, more slowly than I would have expected when we did have a lot of support from the Premier's office to get that done. I'm hopeful that now that this part of the budget cycle is done and they're looking ahead to the campaign and the bureaucrats are looking ahead to the 2025 budget, that we can start to integrate those metrics there. And it's why at the federal level, we really need something like a commissioner for generational fairness. We have a commissioner for environment and sustainability. We should have one on generational fairness or a task force or something like that. The Feds just hosted a summit on auto theft. Don't get me wrong, auto theft is, no one wants to lose their car, and apparently it's $1 billion problem. But the budgets I'm showing you, like $1 billion is a rounding error in how much we're increasing spending on old age security, and it's there's $100 billion gap between old age security and childcare. So if $1 billion auto theft problem can get a summit, I think intergenerational fairness should too. We are working tirelessly to try and make that happen. Maybe for the 2025 federal budget, there'll be some reference to that. I don't know. Fingers crossed. That's why, though, maybe that's a good segue, and we're running out of time. So I'll return to how can our community contribute as a budget season hero? And so I would like to draw people's attention back to the budget actions. And, I wonder, you'll likely heard like, hey, reach out to your MPs and say, we need this task force. If you're in BC, celebrate the strategic plan achievements, tell them to go further, go do more. If you're outside of BC, say, hey, learn from the BC model. Let's integrate that incremental step into our budgets. And more generally, drive up interest in our communities about why budgets matter, not just for a couple of days, but all year long. I wonder if there's anyone out there in the community call who's like, yeah, I can do some of that. Or before I would do that, I would need some help thinking about X, Y, or Z. Anyone out there want to jump in?
Hey, Paul, can you hear me?
I can, Eric. Thank you.
Oh, great. I really respect the work that you do. And out here in Ontario, I think the thing that I've been focusing on a lot is housing. Even though you've covered a pretty broad gamut, everything is integrated after all. So I do have conversations from time to time with my political leaders, with my MP. And I was wondering, how would I get such a conversation started on generational fairness? What kind of points could I raise to her the next time I see her?
Yeah, that's a great question. I would encourage you to come and look at some of the resources that we have on our website, including at that budget actions. I think that some of these, like the videos and the reasons to care about budgets, will give you some of that stuff. But since you said housing, I would say housing is sort of at the epicenter of the generational tensions in Canada right now. And if I were you talking to political leaders in Ontario, I'd say, during the first couple of years of the pandemic, we saw a greater increase in housing wealth over a 2-year period than at any time in anywhere else in the country in the last half century, even more than British Columbia. And I think Gen Squeeze has been very successful at getting people to recognize that rising home prices have been hurting younger folks and newcomers of any age, and a more modest group of seniors who are renters. But we haven't recognized that rising home prices are benefiting people. And this matters in Ontario, because in Ontario, like the whole narrative is so about we need to build more, we need to build more, we need to build more, and we need more supply. We need to add density in land already reserved for residences, not in the Greenbelt. But we also need to recognize that if supply were the only factor, then Alberta should have higher home costs than BC and Ontario, because it has lower levels of supply per capita than do BC and Ontario. But Alberta doesn't. It has home values that are too high, but half the value of Ontario and BC in a lot of cases. And so we need to recognize that in Ontario and BC, sort of the psychology of our market started getting out of hand. And in Ontario, it came later than BC, but it's just so frightening to watch, and the harm that's unfolding in cities, not just Toronto, but throughout the region. And so I would encourage you to say, if we want to look at the lens of intergenerational fairness as it is with regards to housing, we've extracted so much wealth out of the housing system in Ontario right now that we've left little affordability for those who follow. And we keep thinking if we just build more units, well, then, we're going to get stuff that people are going to afford. But what's happening is we're building more units and the price is often coming in at the new price, not at a more, affordable level. And so it's going to take those of us, people like me who've been benefiting, we need to ask us to get off the sideline, and because we love our kids and our grandchildren and want to be good neighbors and citizens, like how can we contribute more to solutions? I think the intergenerational lens brings something to the housing that your provincial government right now often doesn't acknowledge.
Mm, that's great. Thank you so much. From a policy perspective, though, what is the most useful tool that we can advocate for? I mean, would it be, a friend of mine always talks about blind bidding, for example, ending. What do you think would be the best thing?
Yeah, I get this conversation. If we had $1 for every time I get that question, Gen Squeeze would be a rich organization, and like we wouldn't have any funding problems whatsoever. Um, Truth of the matter is, though, if you go to gensqueeze.ca, you click on our solutions, and one of the tabs will be housing. And I wish there was a silver bullet. There isn't. And so, yeah, we should, blind bidding something that we can work on out west these days. We just had like a speculation. We've had a speculation tax. Now we have a flipping tax. We're cracking down on short-term rentals. We are building more supply. We are incentivizing the city councilors like Dave of the world to like add density and zoning. And the city councilors are responding. At Gen Squeeze, we would say, you want to do the deeper, harder work now? We need to break our addiction to high and rising home prices. And so I'm looking at ways to say, like, how is it safe for a politician to say, we don't want home prices to rise anymore? And here are the deeper policy issues that we need to address. Like there's problems with measuring housing inflation, that giving the wrong signals to the Bank of Canada. We have problems with the way that we shelter wealth windfalls in housing, like we don't shelter other assets. And these things then give rise to our like commodifying housing in ways that have fueled some of the problem. So that's a lot of what Gen Squeeze is working on, but that's not one single thing. Friends, it is 12:56. I Maybe we could take one more question, although that'll mean that I'm going to rush through the very last things that I'm going to say. So is there one more question out there?
There was one more that came in through social media, someone that couldn't make the call today, but they had recently read our report on the access to family doctors and how they were shocked to find out that we actually have more family doctors now per capita than we ever have before. And they're wondering about obviously we need to adjust our spending, but how can we also address that problem without giving up on the other things that we know keep Canadians healthy and well in the first place?
Yeah, I think that's at the heart of the Gen Squeeze work. What a lovely segue to wrap up. At Gen Squeeze, I think on the one hand, we're an organization that says, we just we need our economy to focus on like getting productivity, not just more GDP, and that will drive more revenue the more productivity we have, and that will help with our revenue issues. And at Gen Squeeze, we're like, sometimes we're not spending as efficiently as we could, and I think we're loud voices that can be provocative and say, folks, there's ways to have more efficiency in our medical care spending and in our sports, in particular for retirement income security. But we're also saying we need to still protect a medical care system and our retirement income system at a moment we have an aging population. That's going to take resources. And we need to invest in the building blocks for a healthy society, which will also often mean investing in younger folks. So I think it comes down to now a revenue conversation. We're heading in BC into an election in the fall. It's a little over a year at the federal level. But in any election I've witnessed of late, you'll have effectively voters saying, okay, you can earn my vote if you'll promise to spend more to address some of our problems, but I don't really want to talk about the how we're going to raise the revenue to pay for those things. And I think that all of us, I think at Gen Squeeze, we're trying to socialize amongst our community. Like, how do we make it politically feasible for our politicians to talk about raising revenue, or how to do that efficiently without just completely eliminating their electoral circumstance or electoral chances? And that's on us to create the political culture of how do we pay for the candidate that we want. Because right now, if we're just hoping we can have more spending but no more revenue, that's going to leave unpaid bills for those who follow, and that is not a generationally just thing. So friends, as I see we're clicking on 12:59, let me acknowledge that we will be sending out or making available in the days ahead a recording of today's community call. We will be sending to everybody a survey requesting your feedback. What are you liking? We're still in relatively early days of hosting community calls. What's working? What isn't? How would you improve them? How often would you like them? I can't quite announce when we'll do our next community call. Maybe also around the federal budget if there's some interesting things to highlight, and depending on people's interests. But with that, I don't want to make anyone squeeze for time to carry on with their day. And we will bid you adieu. And thank you so much for joining the February community call.
I will just add that we're very active on social media, and our most engaging platform is Substack. So that's a place where we can have lots more of these nuanced discussions. So join us over there. You can go straight to our website to find the link to that under the Get Involved tab, and then scroll down to join us on Substack. Thanks so much.